Welcome everybody to today's episode of the Great Birth Rebellion podcast. My name is Dr. Melanie Jackson at Melanie the Midwife. I'm a clinical and research midwife with my PhD. Our Great Birth Rebellion premium members also get access to podcast transcripts, additional resources, the Ask Mel a Question button, and an exclusive monthly Ask Me Anything episode. That said, let's get into it. Today's episode is for Lou and Libby, and any other woman who has had a caesarean section and found that their obstetrician repaired their uterus using a single layer closure method. But this episode is also for any woman with a previous caesarean section so that you know what your body is capable of for your next birth. I'm a midwife, not an obstetrician, but I am a researcher. So to create this episode, I've used 4 research papers, 2 of which were systematic reviews, which means that they drew together lots of different research and collated the results. And those research papers are in the resource folder, and you can get access if you're on the mailing list for this podcast. When a client comes to me and would like to plan a vaginal birth after caesarean, VBAC, at home, after saying yes, I seek out their medical notes from her previous birth. So I'm curious to know why the caesarean was indicated in the first place and the events that led up to it. If there were complications during the surgery, such as needing to extend the incision on the uterus, or if there was extra bleeding or scar tissue or errors. And what the healing journey was like for her. Did the wound heal well? Were there any infections? Did she need to be readmitted to hospital? And have there been any longer term side effects? The other information I'm looking at is the obstetrician's notes on exactly how they performed the caesarean section and the closure of the wound afterwards. Was it single or double layer? Did they use locked or unlocked stitches? Was it a continuous stitch, or did they incorporate some knots into that? In most circumstances, the process of a caesarean is the same, but there's lots of little clinical details and decisions that the obstetrician can make when performing one. So today I'm talking about the detail of how the uterus was stitched back together afterwards. And I'm answering the question of, if the obstetrician only used a single rather than double layer technique, can I still plan a VBAC? So today I'll go through what a single layer repair is compared to a double layer, and does it increase your risk during your recovery or afterwards for your next birth? So what is a single layer repair? When you have a caesarean, the obstetrician will cut the external skin layer and then fat and the facial layer, and the abdominal muscles are pulled to the sides by severing the connective tissues between the abdominal muscles, and that reveals your uterus. This is then cut low, sort of over your pubic hair line around that location, in that direction. And once the baby and placenta are born, the doctor will go ahead and repair and replace each individual layer, starting with the repair of the uterus. And at this point, the obstetrician can choose to close your uterus with a single layer of stitching, and there may be locked or unlocked stitches depending on if the wound is bleeding and how well it's going back together. If they lock or unlock them, then this is a clinical decision usually made at the time. An unlocked stitching technique is just they'll stitch and then just keep going continuously all the way to the other side. They may lock some stitches with a tighter knot, like a blanket stitch. If they see certain areas that are bleeding, they might put in a knot there to stop the bleeding or to close some areas tighter. And then they'll keep going with a continuous unlocked stitch. Some obstetricians will just stop there with a single layer repair, going from one end to the other with either a combination of locked or unlocked stitches or whatever their usual technique is. Others will go back over it again and do a second continuous stitch layer over the first layer, and that's called a double layered repair. There's just 2 layers of stitching. And we've got to remember that the idea of stitches in any part of the body is just to bring the edges together so that your body heals those edges together and knows what to heal together, and to ensure that there are no blood vessels that are exposed and bleeding. So there might be a single layer or a double layer needed to achieve that. And that's a decision that's made by the obstetrician at the time. So now the question is, if you've had a single layer repair, does this rule you out of the option of vaginal birth for your next baby? And does a single layer repair increase the chance of uterine rupture? And here is where the research comes in. Now, we heard from Hazel Keedle last week that there are very few circumstances that would rule women out from planning a VBAC. And those reasons are usually the same ones that would rule any woman out from a vaginal birth. For example, if the placenta was placed over the cervix in a complete placenta previa, or if there's an abnormality with how the placenta is implanted into the uterine wall. So if you discover that you've had a single layer uterine repair, this does not rule you out of planning a VBAC because it's not about how the uterus was repaired. The question is in how well did your uterus heal, not how was it put back together. So, did my uterus heal? And if it did, and there are no gaps in the healing, and the wound healed without infection or coming apart after your recovery, then that's way more important information than how it was put back together. So let's have a look at the research, and I'm going to start with this older study done in 2003, just to show you that this is not new information. And I want you to see that actually for at least the last 20 years, we've known what the impact of a single versus double layer suturing has on next birth outcomes. So this study was done by Derwald and Mercer from 2003, and they retrospectively, so they looked back at the outcomes for VBAC in their facility, and they tracked it back from 1989 through to 2001. And 768 women met the inclusion criteria for their research, and there were 267 single layer and 501 double layer closures that they included. And all the women in this study had had a caesarean for their first baby. So this was their second baby. None of them had laboured since their first caesarean. In their study group, of the women who had a single layer repair, 68.2% went on to attempt a vaginal birth for their next birth, and 67.9% went on if they'd had a double layer to attempt a VBAC. So pretty similar. And of these women, 68.1% gave birth vaginally if they'd had a prior single layer closure, and 64.7% if they'd had a double layer closure. So still very similar, slightly lower for the women who had double layer closure. So for the women who'd planned to have a VBAC, 68.1% that had single layer closure went on to have a vaginal birth, and 64.7% who had a double layer closure went on to have a vaginal birth. There were no uterine ruptures in the single layer group, and there were 4 uterine ruptures in the double layer group. But let's remember that there were 267 in the single layer group and 501 in the double layer group. So it's slightly higher, but still they considered that these results were fairly comparable. And they said that their findings were consistent with 2 previous studies that found no increased risk of uterine rupture with single layer closure. And their study, they had 4 uterine ruptures with the prior double layer closure. But this study was done in 2003, and the authors do admit that in order to properly evaluate the exact statistical chance of a uterine rupture, they would have had to have over 3,000 women in this study to have adequate numbers. So there's a gap in the fact that there was only a small number. However, what they have found, that of 267 women who had a single layer closure, there were no uterine ruptures. This does point some way to indicate that there isn't an increased risk. And this is where some of the future studies come in, which have far larger numbers that can help make up for this gap. So let's look at a study that was done in 2014 by Stephanie Roberg and her team, and it's a systematic review and meta-analysis, which means that it pulled lots of different studies on this one topic of single versus double layer closure, and it analyzes the data together, which helps with this issue of having big enough data numbers to get a meaningful conclusion. This 2014 study, they looked at the impact of single versus double layer closure on adverse outcomes and uterine scar defects. And in their paper, they state that there is no consensus about the optimal way to close the uterus after a caesarean section. So this was done in 2014. Still, at that point, haven't quite agreed what the best way to close the uterus is. And they state that there is growing interest in the impact of single versus double layer closure on the risk of uterine rupture, and they believe that their review and meta-analysis could provide additional evidence regarding optimal uterine closure techniques for short-term outcomes and scar defects, and they also looked at long-term outcomes such as uterine rupture. So they did a systematic search of the literature, and ultimately 20 studies met the criteria for their paper, and in this, that included 13,000 women. There were only 6 trials that detailed uterine scar evaluation with an ultrasound. 3 of them reported on the risk of uterine scar defect, and only 2 studies reported on the next pregnancies and the risk of uterine scar dehiscence or uterine rupture. And they concluded that single layer closure was not linked with significant risk of uterine scar dehiscence or uterine rupture compared to double layer closure. Their conclusion, however, found that current evidence based on randomized control trials does not support a specific type of uterine closure for optimal outcomes, and the current evidence is insufficient to conclude about the risk of uterine rupture. Meaning here still, again, 2014, there is some research, but not enough to make definitive conclusions. Now, this process of meta-analysis was repeated again in 2021 by another group of researchers. They found 18 studies, and they suggested in their conclusion that both techniques were comparable in terms of healing, readmission rates, how long women had to stay in hospital, the amount of blood that was lost afterwards, the risk of maternal infection, and the risk of uterine dehiscence or rupture during their next pregnancies. They stated that the stats were similar for both techniques. So neither technique was deemed superior over other. So if we are willing to facilitate VBAC for women with double layer repair, then the evidence indicates that there's no greater risk if there's a single layer repair. Now, these research papers did reference the finding that sometimes after caesarean repair, a woman's uterus can heal with a window or a niche in the scar. And this is not specifically about the technique that was used. It's simply a finding that the uterus was either not put together well or didn't heal well. And sometimes this can occur if the woman's healing was slowed down or impacted by infection at the time. And as I said earlier, the technique used for closure appears to be less important than how the wound itself heals. So to suggest that a single layer closure excludes women from VBAC or increases the risk of uterine rupture misses the point. We're looking at the procedure rather than the outcome for the woman. A better question to ask is, did the uterine wound heal well and completely? And if the answer is yes, then the closure method is irrelevant. Now this brings up a topic for another day about strategies to aid in healthful healing from caesarean section, but that is for another day, and I'm sending all my love to Libby and all the women fighting to have their birth choices honoured. And I hope you go forth and have the birth that serves you. If you'd like the opportunity to ask me questions, then you get access to me in the Premium Members Hub. The Premium Members Hub offers listeners a unique experience of additional episodes that answer questions submitted by listeners. By joining the Hub, you support this podcast so I can keep creating amazing content for you every week. Thank you for being here for today's episode of the Great Birth Rebellion podcast. If you want to get access to all the resources that we use to create every single podcast episode, you can join the mailing list at melaniethemidwife.com, or better still, the Premium Members Hub. The Premium members get access to transcripts, the Ask Mel a Question button, an exclusive Ask Me Anything episode every month. All the details are in the show notes, and I will see you in the next episode of the Great Birth Rebellion.